that's the way I think of the difference between pain and suffering. So, we can add layers of suffering to our core pain, and when actually all we needed to do was deal with the core pain in the beginning. And if we can do that, then we can avoid adding on those layers and layers of suffering. And I guess this is where that skill of radical acceptance comes in with DBT.
You have found the Thinking Mind podcast.
People should know that we've actually worked together before. We've co-facilitated DBT groups, and I'm very interested in DBT. Although I'm currently studying humanistic psychotherapy, the concepts in DBT really fascinate me, particularly their relationship with mindfulness, and I just find they're just very useful ideas for navigating difficult situations. So I'm really looking forward to discussing all of this with you. But first, maybe you could tell me what attracted you to working in mental health. How did you find yourself working in mental health settings?
Gosh, okay. It happened by accident, really. I finished college and didn't know what I wanted to do. So actually it was my mother that suggested going into nursing, and I always thought of nursing as sort of bedpans and wound care. I didn't realise at that young age that there was actually a psychiatry arm to it. So that's how I ended up going that way, because I already worked as a healthcare assistant in dementia care. So that's where I started. So I entered my psychiatric nurse training at the age of 18. So I was really, really young when I started. I was qualified by the time I was 21, and I started working in an acute psychiatric hospital on a mixed ward. We had mixed wards back then. And that's when I came across a client group who were, recurrently suicidal, who were engaging in self-harming behaviours. And I really wanted to understand a lot of the behaviours we were being presented with on the ward. And at that time, we had a consultant psychiatrist working on the ward who'll always have a place in my memory. And he was just fantastic with this client group. And then he introduced me to one of the nurses who was working on the ward, and she was the one who told me all about borderline personality disorder and DBT, and introduced me to Marsha Linehan's first DBT training manual at the time. And so she was the one that got me hooked, if you like, on my interests in borderline disorder and DBT.
So you started working in a psychiatric hospital, and you saw this group of patients with, it sounds like, quite chronic difficulties. You mentioned suicidality and self-harm. And of course, this group of patients is often highly stigmatized, particularly in inpatient settings. I find in hospital, it seems like patients with, let's say, schizophrenia, psychosis, bipolar, it often feels like that they're prioritized over patients with personality difficulties. And it sounds like you saw that there were clinicians who are actually trained to help them sort out what their difficulties are, because it just feels like there's a whole, DBT is one aspect of many aspects to help that can help people with these problems, and it's just not talked about, particularly in inpatient settings, very much. But it sounds like you're quite fortunate to find some clinicians that are quite skilled in that area.
Yes, I mean, it was primarily left up to this one nurse to manage all these patients, because she had a special interest. And we had two consultant psychiatrists on the ward at the time. So she worked with one consultant psychiatrist specifically with this client group, and they had other clients under their care, of course, with different diagnoses, but it was really left up to them, because they were the ones that sort of understood it. And the other patients on the ward were sort of managed by everybody else. So already you were kind of getting that split between, well, we'll look after those patients, you look after those ones, because no one likes to look after those ones. So if you've got an interest, you look after those ones over there, and you'd be allocated to those people every shift. And at the same time, I think that was also a helpful thing, because I think it was better to have people working with people because they wanted to, and because they had a special interest. Because I think in a funny sort of roundabout way, I think those people ended up getting the care that they needed from people that wanted to give it to them as well, from people that were trying to understand it.
Now, to someone who has no background in psychotherapy or psychology, how would you explain what DBT is?
So DBT is Dialectical Behaviour Therapy. Now, one of the leading first point of call therapies, if you like, for people with borderline personality disorder or emotionally unstable personality disorder. So those are the two sort of diagnostic labels you'll hear more commonly. And it's recommended in the NICE guidelines as a first port of call for those clients who are engaging frequently and lethally in suicidal and self-harming behaviours. So DBT is also it's principle driven. It's not a protocol, and that's the great thing about DBT, is that it's driven by principles. And DBT is also mindfulness based, so it draws upon the Buddhist Zen principles as well. So it very much focuses on the here and now, what's happening in this present moment, what's existing in this present moment, and looking at how we can work with people on what's happening here and now, rather than giving a focus on the past and the future. Although people do have a past, and that's what brings them to where they are today. And at the same time, we are focusing on helping clients work towards the future, working towards a life worth living. So I suppose one of the most important things to know about DBT is that it's not a suicide prevention treatment, but it's more a therapy working on a life worth living and working towards goals to create that life worth living. And we treat very much the suicidal and self-harming behaviours as problems that need to be solved in order to help clients to work towards their goals and that life worth living. So in DBT, we'll have sets of behaviours that we call target behaviours. And we need to target these behaviours. We need to work towards reducing and eliminating behaviours that are getting in the way, that are the obstacles to this individual moving forward and having a life that they would like to see.
So, as you said, DBT is based on teaching people principles that they can use. A lot of it is based on mindfulness, and I think the quality you mentioned, that it's about working towards positive goals rather than just trying to remove negative symptoms, is really important.
Exactly, because once that's removed, what do you have left? So it's it works on both. It works on both, yeah. So while we're working on eliminating one, we're working on improving another, which is those goals.
Yeah, and of course, this is part of the medicalization of mental health problems in general, and why it's problematic. If you just treat problems like suicidality as symptoms of a disease, you strip away their meaning, and you're not making any kind of correlation with what their quality of life actually looks like. So you can get bogged down in dealing with suicidality quite a lot without actually helping people to improve their lives.
Yeah, absolutely. And suicidality isn't a symptom per se. It's a way that an individual has learned to cope with either painful emotions or situational difficulties. These are maladaptive ways of coping, if you like. So DBT also teaches the individual certain sets of skills. So, mindfulness is the core skill, and we also teach clients skills around interpersonal effectiveness, around emotion regulation, and around distress tolerance. So clients will learn all of these skills within the DBT program, and the expectation is that we work through 2 cycles of all of these skills during that program. Because the first time round, people are kind of learning it, they're trying to implement it, trying to kind of get their head around it. And the second time round kind of really helps, I think, sometimes for the kind of the penny to drop and things to really start to make sense the second time we go round and learn the skills again.
Yeah, what I find really interesting about DBT is some of the skills are very, very practical, and it can be as practical as if you're in a bad mood, do something you enjoy, to direct you to do something you enjoy, like watch a film you really like or spend time with friends. So very, very straightforward practical advice. And then on the other end, it can be like super deep, like talking about how to establish a relationship with suffering and tragedy. There's one small passage I read in a DBT book which talked about how resistance to suffering is like the road to hell, something like that. It was very like expressive language, very almost hyperbolic, but I guess it makes sense because of its links to Buddhism. It's almost halfway between psychology and spiritual thinking.
Yeah, and of course, the biggest dialectic that DBT is based upon is the dialectic of acceptance versus change. And you'll see in the skills training manual that a lot of the acceptance skills draw upon those Zen Buddhist principles as well. So whereas we're kind of accepting the individual as they are, where they are, at the same time, we're also encouraging them to make changes to their behaviors so that they can work towards a life that is worth living, one that they can cope with, and learning those skills and implementing those skills to help them work towards that life worth living.
Yeah, the interesting thing, the paradox of change is, if you want to change for the better, obviously you have to want things to be different, but you also have to, as you said, accept yourself wherever you happen to be in any given moment. Because if you don't, I think emotionally you get so mired in like guilt, shame, hopelessness, that any change is impossible. So like, say you want to lose weight, it's like you have to want to lose weight and change and do the things that will move things in the right direction. But whatever weight you happen to be now, you kind of have to accept it too and learn to appreciate yourself at the same time.
Yeah, I guess you could say that about most things, couldn't you? I mean, if you take addictions, for example, before you can start to move on and change, first of all, we need to work on accepting that actually, I have a problem with drinking alcohol, or I have a problem with taking illicit substances, or I have a problem with food. Food is kind of like the new addiction. I have a problem with exercise. People become addicted to exercise. So yeah, I suppose the thing is that we need to first of all accept that there is a problem before we start to work on it. And also we have to want to work on it. We as the individual, we as the client need to want to work on it. Not because we want to, not because other people are saying that we should do.
Exactly. And I've found in DBT, when we were doing groups, I always found myself repeating to the clients, like, you guys are in charge. Like, it's not what we want for you. We teach you principles, but how you use those principles is entirely up to you. We don't tell you what to pursue in life or what to consider a high quality of life, because that looks different for every individual. And it's this kind of repetitively trying to put the client in the driver's seat, which is so different from medical practice, which I really liked.
I think it's quite different from most therapies as well. I think that's one of the wonderful things about DBT is that, really, we're there acting as a consultant to the clients. And I think for some clients at first, that's kind of a bit alien, for a therapist to be, working with them in that way. So, I often have these discussions with my clients, that, I'm not here to tell you what to do. I'm not here to advise you on what to do. I'm here to act as your guide. And what I'll help you to do is implement the behavioural skills that you need to help you achieve X, Y, and Z.
Exactly. It's a long program. It takes, up to a year, 2 years to complete a program. How do you see people change and evolve during that time?
I've got some wonderful stories that come to mind about clients that I've treated over the years. I mean, I've been treating clients with DBT now since 2003, 2004. So over the years, I've seen some miraculous changes. I've seen some sad things, but I've also seen some very, generally some very happy things, a majority of very positive outcomes. So I've seen clients who have been engaging in really significant self-injurious behaviour. And one lady, she was a young girl at the time, actually, who I met on the acute wards, because at the time I was working between the acute wards and the therapy services. So I did some pre-commitment work with her on the wards. And then eventually we managed to get her to a stage where she could access therapy in the outpatient clinic. And fortunately, it was me that picked her up on the waiting list there. So I already had a good relationship with her. And she is now a social worker, I believe, for a CAMS team somewhere else in the country. So that was a great success story, I think, for one particular client. I think the essence is that DBT works. It does work. However, the therapy will fail clients. So, people cannot fail at DBT. But however, if it's not the right therapy for that person, or, we get into a place where motivation and commitment starts to waver and we can't pull it back, at that time, DBT can fail the client.
Do you think sometimes people are too young for DBT? Because I've seen young people do it, 18 years old, say.
Never. In fact, I think definitely the skills part of DBT, I think these are skills that all of us can benefit from, no matter what background, no matter what culture, no matter what walk of life, no matter what age. These are a wonderful set of what I call life skills, really, that I think should be on every single curriculum in every single school. So as much as academia is important, life skills are just as, if not more important.
Yeah, life skills, emotional intelligence skills, knowledge of oneself. We don't talk about that at all with young people. I found when I was learning about DBT and delivering it, that without even realizing it, when I would then face a problem in my own life or some kind of difficulty in my own life, my brain would go to DBT skills that I had used that week or something. Have you found that a knowledge of these skills has helped you in your personal life?
Absolutely. Every step of the way. I always say this to my clients, that, I think this, again, like I've said, this is a set of skills that, we can all benefit from and continue to benefit from, even when we've learnt them. There's always something to learn.
And what do you think, what's the difference between pre-DBT Michelle and post-DBT Michelle?
I think without the skills and without implementing the skills into my own life, I think my life would be very different to what it is now. I think it's extremely helpful in any relationship. I think it's very helpful in intimate relationships. I think it's very helpful in family relationships. with my young daughter, even now, even at the young age she's at. I find the skills very useful, especially mindfulness and distress tolerance, and at times, and with work, with work colleagues as well, friends at times.
The truth is, so much of life, and so much of success in life, particularly over the long term, rests on emotional regulation and emotional control. That's how we distinguish children from adults, right? Children are much more volatile and much more emotional. And when adults act like that, it's quite scary. And we tell them to stop acting like a child, because you can't get anything done if you're constantly the puppet of your emotions, like the puppet of your anger or your sadness or your anxiety. And I find DBT really helps to take a step back and put things in perspective.
Oh, absolutely. And I think also, a very important thing to remember about the clients that we see is that, these individuals are also, the theory is also that these individuals are born with emotional vulnerability and emotional sensitivity. So and you pair that with an environment that has been invalidating, and there you have it. You have a nice mixture there for the diagnostic labels in which it attracts. And I think it's important to remember that primarily it's a functional problem of the emotion regulation system, isn't it?
Yeah, it's like if you have a very unpredictable early life environment, your emotions are kind of an indicator of how consistent, predictable, or safe your environment is, right? So if your environment is volatile, your emotions need to be similarly volatile to prepare you for action. So for example, I guess if you're in an abusive household, it makes sense as a child to develop, let's say, high levels of fear, because that will motivate you to do the things you need to do to get out of a dangerous situation. With the last podcast I did before this was about the functions of different emotions, which actually was taken from DBT theory. And then the problem is when you then grow up and then you enter environments which are comparatively safe, but you still have these really jacked up emotions which are with very low thresholds for activation. So you go into a situation which is vaguely similar to your childhood situation, but not the same and not as dangerous. And yet you still have a huge cause of fear, for instance, or anger or whatever the emotion is.
Yeah, absolutely. And a big part of DBT is learning about that as well. Is learning about how for the client how things have ended up this way, and this is often where we in pre-treatment we will talk about that biosocial model, that biosocial theory of how the invalidating environment and the emotional vulnerability and sensitivity interact with each other. One of the main skills and one of my favorite skills in DBT is that emotion regulation set of skills, helping the client to understand what emotions are, first of all. I mean, some clients don't even know what to call the emotion that they're experiencing. They know it's there, they know they're reacting to it, but they can't tell you for the life of them, what that emotion might be. So it's very good at helping clients to label exactly what it is they're experiencing, and also not just to label it, but also to start using the mindfulness skills as well, helping them to become more attuned with the physical body as well, because the physical body can give us lots of signals as to what the emotion could be. Yeah. So for example, if I've got a racing heart and my breathing's becoming shallow and I'm starting to get pains in my chest, I might go, okay. So I know that those are symptoms that fit with fear.
And it's amazing how many clients, like you say, they don't have that emotional self-knowledge. And it's like the longer, I always compare it to having junk building up in your attic. Like the longer you spend not examining your emotions, your kind of psychological inventory, the more bad stuff piles up there. And then when you do start exploring it, the more terrifying it is and the harder it is. So it's really something best done kind of regularly.
Yeah, absolutely. And, I think for a lot of our clients, I think a more accurate way of describing emotional dysregulation sometimes as well is it's like an emotion phobia. It's almost like our clients have this phobia about their emotions. They haven't learnt yet that actually emotions are completely valid in the context in which they're being experienced. They're normal, they're natural, and they've shown up to tell us something. They've shown up to give us a really important message. So it's vital that we don't shut them down, that we listen to what that message is trying to tell us. And it's re-educating people that I suppose in a sense that emotions are not something to be afraid of. They're something to embrace, to listen to, and we can use them to our advantage.
Yeah, and we talk about sometimes emotional sensitivity like it's a bad thing, and it can, if it's too high and you don't have the self-knowledge to go with it, it can be difficult to be very emotionally sensitive. But it's also a tremendous advantage because emotionally sensitive people can be very empathic. They can tell what people are thinking and feeling. They're really good when it's channeled productively to help groups function more harmoniously because they're so good at gauging the emotional temperature of the room. So it's something that can be really turned around, I think, to help people vastly improve the quality of their life over people who don't have. We all know people who aren't emotionally sensitive at all and get into bad situation after bad situation as a result.
Yeah, I mean, I think with everything, there's pros, there's pros and there's cons, isn't there? There's pros and cons to everything. There's advantages and disadvantages to everything. And yeah, there's, I think the important thing is it's about not judging it. There's nothing wrong. And I think, we tend to live very much in a society where we can be quick to judge. We can be quick to judge things as good or bad or right or wrong. And actually, there's nothing wrong or right or good or bad about experiencing an emotion. Where the difficulty might come in the behavior is how we manage that emotion, how we then deal with it. So if we don't want to eliminate the emotion. What we want to learn to do is to respect it and then to regulate it. So bring it up and bring it down as needed, depending on the situation that we're in. So sometimes, like you said, we can be in a situation and the emotion is probably too high, too expressive for that particular situation. So sometimes we might need to bring it down a notch. Sometimes we might need to bring it up because we're not expressing enough. So this is the important thing, I think, when it comes to regulating an emotion. We're not trying to stop it. We're not trying to eliminate it. Very much like a thermostat on our heating system, we're trying to regulate it so that it fits, it matches the facts of what's happening in the current situation. So emotions are great. We don't want to get rid of them. We don't want to eliminate them.
Exactly, yeah. So let's get practical. Let's say I was a client coming.
We're not going to do star jumps or anything now, am I?
No, we're not going to do star jumps. No, there's a reason I keep this audio only. Let's say I came to you as your client and I have anger problems generally, but I come to you with a specific situation where I felt particularly angry and I'm a bit lost, I'm a bit overwhelmed by it. What process would you go through around that anger with me?
Well, first of all, I'd like to understand it. So I'd like to try and get an understanding of the situation in which you experienced it. what prompted it, what set it off. And I would spend time, first of all, validating it. And I think this is often what we miss in any interaction with anybody, not just our clients, but with each other. Even with our friends, we're very quick to jump into problem solving. Oh, why not just, well, you could try this or you could try that. Or we might also intentionally or unintentionally invalidate somebody. Well, what did you do that for? Well, that didn't make any sense. What? Well, why? And I think asking why is one of the most futile questions anyway. Why anything? So I think, one of the key things, and what I specifically, love about DBT is spending that time to validate, and validation can start with just listening, giving a person your full attention and listening to what they have to say, and validating the valid parts of what happened in that situation, getting an understanding of your experience of anger. What was it that made you angry? Because I bet in there somewhere, depending on what your story is, there is this valid part that that's understandable.
So step one is it's okay to be angry. Almost like feeling angry isn't the problem.
Correct.
The problem is then,
whatever you did.
Yeah, what you did, how you then acted on the anger or not acted on the anger.
Yeah. So if you'd come to me saying that you'd got angry with your boss, something had happened with your boss, and let's say that you felt that your boss was derogatory to you in a team meeting in front of all of your colleagues. Maybe he called you a name or ribbed you or made fun of you. Yeah. Now, that's understandable that you would be angry about that, right? I guess what isn't understandable is getting up in that meeting, throwing over the table and calling him a pig and walking out and slamming the door. That probably isn't going to help you work towards that promotion you were looking to get,
Yeah, and what I love about DBT is it's on a subtle level, it's very strategic. It's not quite, but it's almost Machiavellian in the sense that, let's say the boss did something to even justify me flipping the table and calling him a pig and storming out. You can still argue that that's just not a very effective strategy. It would be far more effective to, detail everything he says, for example, and then talk to his superior about it. It would just be a much more strategic way of dealing with that situation.
Correct. So you're absolutely right. So in situations where the emotion, can be seen as completely justified, at the same time, the reaction to it isn't.
Yeah. So now let's say part of the anger is justified, like maybe my boss talks to me in a particular tone which I feel is condescending, but the level of anger is extremely disproportionate, and maybe it's because my boss in some way reminds me of, let's say, a parental figure who was abusive. So there's something from my past coming into that anger, let's say a lot of it. What next steps can I take to try and process that and deal with it?
So I think first of all, it's validating that bit, isn't it? It's understandable. So it's that level of validation where we say, well, that's understandable. It makes sense that you would experience that if this person reminds you of some, like, from an authoritative figure from your past. That makes sense. Yeah. What we need, and at the same time, what we need to do is help you to problem solve this with your boss. Yeah. So to help you to address, and that we can use another set of skills for that as well. So we can use problem solving skills and some interpersonal effectiveness skills to help you address that with your boss. We might want to do some distress tolerance skills there as well. We might want to look at some pros and cons of actually addressing it with your boss. And at the same time, we want to be using some emotion regulation skills, and probably those skills that we call opposite action to the emotion urge. So helping you to act opposite to the urge, perhaps to, to scream and shout or quit your job, to stop you from doing something impulsive. So we can do both. We can problem solve the bit that we need to, the problem that we need to solve, and we can also help you to regulate the anger to an appropriate level so that you don't quit your job, or that you don't punch your boss on the nose, or walk out of a meeting throwing tables around.
Let's dive into acting opposite a bit more, because it's really fascinating and speaks about, I think, the software we all have as human beings. The crux essentially of acting opposite is that if you act as though you are feeling a particular emotion, you tend to start to activate that emotion, and you simultaneously deactivate opposite emotions. So if you, like in this example, if you're feeling very angry, if you do things that an angry person wouldn't do, like for example, smile, or in DBT, they talk about turning your palms upward, you then start to deactivate the anger and then promote more positive emotions. Is that right?
Yeah, so we can act opposite, not just in our actions, but we can also act opposite in our physical body. Is that what you mean? Yeah, so we can use things such as half smiling. We can use things such as open, willing hands. We can use things such as elongating the out breath. We can do things such as paired muscle relaxation. I mean, the first thing we need to do, of course, is identify what the emotion is and the action urge to that emotion, and to get an idea of what's happening in the body when we experience that emotion. And this is what we call the emotion signature. So every emotion has its own unique emotion signature. It has its own unique set of physical things that happen in the body. And this can be things like our posture, it can be things like our muscles, it can be our voice tone, the volume of our voice, our facial expressions, our temperature. Yeah. So within that emotion signature, we have those other smaller headings. And under those smaller headings, we need to start to understand what's happening in our body, so that when we need to act opposite, so when it's appropriate to act opposite, so for example, let's stick with anger. So let's say, for example, I'm in that meeting, my boss is doing something that I perceive to be inappropriate, or speaking to me in an inappropriate way. I might start to notice that tension in my muscles, my stomach starting to knot, my jaw starting to clench. I might start noticing that my voice tone is starting to get a little bit clippy, or the volume of my voice is starting to raise, my breathing is starting to change. So in that moment, if I can become aware of that in that moment, I can then start to do things to act opposite in my physical body, which hopefully will have a knock-on effect with the intensity of my emotion as well. So by acting opposite, by relaxing my muscles, taking a breath in that moment, making sure that my fists aren't clenched, making sure that I haven't got anything crossed, that I might decide to roll my shoulders or just raise my eyebrows slightly. That in itself may help just to bring that emotional intensity down a notch, so that I can be effective in that moment and not act on impulse.
Yeah, so you're really training people to become experts on their own emotions, how they feel them, what are the warning signs that a difficult emotion is coming up, and how can I start to dampen down that signal if I feel that it's appropriate to, because obviously there are situations where I feel it is appropriate.
Yeah, so for example, if someone was trying to take my handbag off me, if someone's trying to run off with my handbag, I'm not going to want to act opposite to all of that. I'm going to want that to use that to fight to get my handbag back. Thanks very much.
And on that point, a lot of clients and also a lot of people I meet actually who work in healthcare, what they need is training to actually be more angry when it's appropriate and be more assertive.
Exactly. Yeah. So sometimes we might need to help people this is what I was saying earlier about that regulation system. Sometimes we actually need to regulate an emotion up to get the desired effects. And I think sometimes when you talk to even clinicians, I think a lot of people think that the automatic thing we've got to do is get an emotion down. And so I like the fact that you've mentioned that there, because that's very important. Yeah, this is about regulation. So sometimes it's not about reducing, sometimes it's about increasing somebody to act in a way to be effective.
Yeah, and this links back to suicidality, I think, because Freud thought that part of what self-harm was turning aggression that should be directed outwards, inwards, because for whatever reason the individual feels that they can't direct their aggression outwards, and that results in a degree of suicidality and self-harm. And I think it's a very important point, because I think a lot of people do grow up in households where it's not okay to be aggressive. And so when it comes to relieving any psychological tension at all, they might direct it at harm towards themselves. And that might be self-harm, like cutting behavior, but it might be other things like we talked about, like behaviors around food, around exercise, all of those things.
Yeah. In DBTs, this is what I've said before, as I said earlier on in the interview, DBT is very much about learning sets of skills that we've probably missed out on whilst growing up, and that's no one's fault. It's just no child is born with a book of instructions, and also our caregivers have also grown up in a particular set of circumstances as well. So they're just trying to do what they think is the right thing, or how they think they need to handle a problem. So often, you find that individuals have missed out on learning that actually emotions are okay, and here's the way of dealing with it. But like you said, when people grow up in a household where they're taught it's not okay, what do you do with all of that? So the suicidality and the self-harming behaviors that come out of that in DBT, we view very much as problems that need to be solved, because often the individual doesn't have skills, and they don't have skills in problem solving. They don't understand what's happening, and they think that the only solution are these behaviors. This is what will make it stop. And a lot of the time, even with self-harming behaviors, even temporarily, it stops. So that too works to do something. It doesn't solve the problem in the long term, but it sure as hell does for them in the very short term. And that's what keeps that behavior going, isn't it?
Yeah, exactly. And one of the principles that I really like in DBT, which I've actually done an episode about, is pain versus suffering. Tell me a bit about the difference between pain and suffering.
So I would say think of an onion. Think of think of pain as the core. As you start to peel away the layers of the onion, you eventually get down to that little bulb right in the middle. And all those layers of onion are the suffering that's over the top. And that's the way I think of the difference between pain and suffering. So, we can add layers of suffering to our core pain. And when actually all we needed to do was deal with the core pain in the beginning. And if we can do that, then we can avoid adding on those layers and layers of suffering. And I guess this is where that skill of radical acceptance comes in with DBT. You know, being able to radically accept in the moment that things are as they are in this, all that exists is this moment, and things are as they are in this moment. You know, we're not saying that we're approving of anything. Acceptance doesn't mean that we're approving or saying something is okay. What we're doing is accepting that right here, right now, this is my situation. This is what's happening in my life. And if I can accept this one moment, I can then start to make steps towards changing. But the more we resist reality as it is, we start to add those layers onto our onion, those layers and layers and layers of suffering.
Exactly. So resistance to pain produces suffering and just makes it much worse, and puts you in a much worse position to actually solve any of the problems which caused the pain in the first place.
Yeah, well, you imagine if you broke your leg, for example, you know, you break your leg, but you refuse, you know, you're running the London Marathon, you fall over and you break your leg. You refuse to accept that the leg is broken, right? So what do? You get up and you keep trying to run, but the more you keep trying to run, the more you're falling over and then causing even more injury to yourself. Maybe then you break your other leg because it can't take the weight of you, you know? Whereas if we had just stopped at that first moment and gone, do you know what? I've broken my leg. I'm not going to finish this race today. We're most likely just going to deal with the core pain rather than adding those layers of suffering if we continue and don't make it to the end.
Yeah, that's a very useful example. And often the suffering isn't so concrete. Like, I don't think most people would continue running on a broken leg, but what suffering often looks like is that internal, like, relentless mental dialogue with oneself. So let's say you've broken your leg during the marathon, you might have really unhelpful thoughts like, I can't believe I broke my leg. This is typical of me. This is just another sign that I wasn't meant to succeed in this marathon.
I failed at something else. Yeah, I just shouldn't bother anymore.
And sometimes, you know, I suppose self-compassion, it's easy to be cynical about self-compassion, and it's easy to see it as corny or whatever. But it's very important. It's very important when the situation is appropriate to just go easy on yourself. Because ultimately, real success and productive work comes from a place of being quite secure, not from a place of like really fragile insecurity, of always trying to strive to be some idealized version of yourself and then constantly failing and trying to recover.
Yeah, I mean, acceptance. I think, you know, being accepting of ourselves isn't something. It's something that I can only talk from my own experience here. It's not something that I often see people do a lot of, and I think, you know, I can include myself in that as well. I think, you know, we don't spend enough time actually being compassionate to ourselves, and I sometimes wonder. I don't know if this is true. I sometimes wonder if it's kind of that Western society that we live in. I mean, we're kind of almost pushed to succeed, pushed to do well, and if we don't, we kind of naturally sort of measure ourselves against others, compare ourselves to others, and I think social media doesn't necessarily help with that either. So we're not really, it's not, it's something that I don't think sort of taught to us from a young age. And again, maybe this is something we need to be thinking about from school age, as much as they're bringing mindfulness into schools from a young age, but also bringing in something about being compassionate to ourselves. Because when do you really hear that? And when you talk to people about that, people don't even really get those concepts. And I think we can all say we're very, very good probably at helping other people and being compassionate to others, but actually when it comes to applying those skills to ourselves, it almost feels quite alien or like we shouldn't be doing that, yeah.
Yeah, it feels foreign. I think it feels contrived for a lot of people. But the truth is, if you look at your own behavior, just how you go through an average day, you are in a relationship with yourself in the sense that you have to negotiate with yourself to do things. Okay, I'll do this not so fun thing so I can do this fun thing later. You have to discipline yourself sometimes as though you were your own child or your own parent. So you are very much in a relationship with yourself. There are lots of different parts of you. And then the next obvious question is, what kind of relationship do you want to have? Do you want to have a relationship where you're totally a tyrant to yourself all the time, or you mistreat yourself? Or do you want to have a relationship that's a bit healthier? And I think that's where kind of a sensible dose of self-compassion can come into play.
Yeah, and I think you need to make that time for yourself as well, because again, we live in a bit of a rat race of society, don't we? But I think also it's about taking time out to actually sit and have that time to think to yourself about that in the first place. It's being able to create that space to do that thinking, and and sometimes some people are not natural thinkers. Some people can't actually sit and think that way, or academically they've not been taught to think a certain way. It's a bit like if you do a GCSE compared to a master's degree. When you're doing a master's degree, you're actually taught to think a certain way.
You're taught how to think critically about something.
Exactly. Whereas when you're doing a GCSE, you wouldn't be thinking that way at all. Does that kind of make sense?
Yeah, I mean, I think there's a profound lack of critical thinking taught in society in general. We're I guess maybe this is part of me thinks maybe this is a function of capitalism, as I think capitalism amplifies certain aspects of human nature that make us very externalizing and comparing us to ourselves. I think this is our nature at baseline anyway, and capitalism just makes it worse.
Yeah, you start to ask about what sort of person they want to be. Oh gosh, well, I've never even stopped to answer those 10 emails today, let alone sort of sit down and have a philosophical think about what sort of person I want to be, or where I'm heading, or where I'm going.
Or the metrics of success are more about how much money you earn, say how much wealth you have. So people say, what do you want to be? They'll say, well, I want to be rich, because that's what our society is constantly projecting as the ideal, is being rich, basically. Maybe being powerful as well, being beautiful, all of those things.
Yeah, you've got to have those, you've got to have those Versace shoes. You've got to have the Porsche. You've got to have the big house in the country and a pony. And if you haven't got that, then you haven't made it.
Yeah, exactly. There's this really good book called Neurosis and Human Growth, which is it's written by a neo-Freudian called Karen Horney. And she was kind of in between psychoanalytic thought and a more humanistic way of thinking. And she basically saw it as you have two options in life. Option A is, you have a realistic view of yourself and an authentic view of what it is that you want to pursue. And then you try and pursue it as realistically as possible. Say you want to write a book. How much time do you have to write in a day? How much energy do you have? How much do you know about the subject that you're writing about? And you approach it very, very realistically and do the best you can. And then option B, and she felt this is where a lot of neuroses comes from, is constructing an unachievable ideal, trying to get to it, inevitably failing because it's an unachievable ideal, and then collapsing into self-loathing and shame and going through that cycle. So in this case, saying not I'm going to write a book, but I'm going to be the best-selling author of my generation. Having those really unrealistic expectations, inevitably failing, and then feeling shame as a result. And I think we see a lot of clients in DBT going between those two positions of I must do everything correctly, and as soon as something doesn't go quite right, I'm a terrible person, I'm worthless, therefore, everything is hopeless, and that's when suicidal thoughts come in.
Yeah, I mean, that's very characteristic of our clients anyway, isn't it? And it's a huge dialect, isn't it? I mean, that very much that kind of black and white thinking. And, actually, what is that? It could be a lack of problem solving skills, and once we learn that set of skills and learn how to set a goal. I mean, if you speak to a lot of people, some people don't even know how to set a realistic goal, a SMART goal, if you like, something that's small, measurable, achievable, realistic, and timed. People, just like you said, tend to go for the big one. That's where I want to be, and I'm going to get there, and if I don't make it, I failed. They're not seeing that actually there's lots of little tiny stepping stones along the way.
It's such a terrible way to be alive.
Yeah.
Okay, Michelle, I've asked you a lot of questions and taken up a lot of your time, but I really enjoyed the opportunity to talk about these things with you. You're welcome back anytime, and good luck with your ongoing work in DBT, and I look forward to seeing you soon.
Thank you.
If you enjoyed today's podcast, we'd love it if you share it with a friend, or you could give us a rating on Apple Podcasts, Spotify, or wherever you listen. If you fancy it, you can even buy us a coffee to support the team, and the links for that will be in the show notes. Thanks for listening.